40 million Americans has this parasitic worm infection. What is it? How do you get it? How do you go ahead and diagnose it? As well as what are some of the treatment options available? So let's get right into the video. It's called a pinworm, Enterobus vernicularis. It's a thread-like worm that is highly contagious. Basically, if you took a small staple and opened it up, that's about the size of an adult pinworm. Most common in school-age children as well as long-term care facilities. It's fecal-oral transmission. Also, you can get it in by breathing the eggs in, and I'll explain a little bit later how that can happen. So, once infected, basically you get the eggs into your gastrointestinal tract. It will hatch and develop into a pinworm, right? An adult pinworm. The females will migrate towards the rectum or the anus, and they will come out and lay their eggs just on the periphery of the rectum and on the skin area, okay? One adult female can lay up to 10,000 eggs. Now, you can have up to 10 worms, 20 worms, or hundreds of different worms in your gastrointestinal tract. So it can lay thousands and thousands of eggs. So what are some of the symptoms? Rectal itching, because when the worm comes out, when it hatches those eggs, it irritates the skin a little bit, and so the child or the individual starts to scratch in the rectum, okay? Also, you can get vaginal itching because the worms can migrate into the vaginal region. You'll have sleeplessness, so you have unrestful sleep. You'll wake up frequently because you're itchy and your body is just not comfortable. You can also have abdominal distress, and there have been incidences where these pinworms will cause appendicitis and diverticulitis as well as a UTI. What that means is these worms will start to migrate into different areas, cause infection, okay? The thing is, the eggs can last outside the host, outside the human body, up to 3 weeks. So let's say a toy or let's say a surface, it can live up to 3 weeks outside the human host. And let's get into how do we prevent pinworm infections or reinfections. I think that's a very important factor here. We don't want to have this continual cycle of killing off, let's say, the adult worms, but reinfecting yourself with the eggs. So it's very important not to get the reinfections. You need to wash your hands, okay? Especially after going to the bathroom or changing a diaper of a child who has the pinworms, before handling food, after handling objects or clothes from the infected individual. So when you do laundry or whatever you need to do, right, you need to wash your hands. You have to teach that child not to put their hand in their mouth, okay? Because what happens is they scratch, let's say the rectal area, and they get the eggs underneath their nails. And then they go ahead and they'll grab at something, or food or toy, and they'll put it in their mouth. That's how you get the reinfection of the eggs. So you get eggs go back into the gastrointestinal tract, and then grows into larger worms again, and then they'll go ahead and lay eggs, okay? You want to keep your fingernails nice and short so you don't get embedding of the eggs underneath the nails, okay? And you want to wash bedding literally every single day. You want to wash the underwear every single day. You want to use high heat. Don't run it in cold water. You want to use high heat, and you definitely want to dry in high heat, okay? So when you take the bedding off, or let's say the underwear, right? Sometimes we have the habit of taking, let's say, a pillowcase or a towel, and we go like this, and we shake it out. We don't want to do that. You want to gently close it up, throw it into the wash your hands. Because when you do that and you shake it, you have these microscopic eggs floating in the air, and that's how you can breathe it in, okay? So it's very important not to overdo the cleaning aspect of it. Just be careful and carefully fold things in and throw it into the wash. And you want to definitely do all these things until you know the pinworm is eradicated, right? So in order to diagnose a pinworm, what do we need to do? One, you can look for the worms because you can actually visually see the adult worms. So let's say a child has it, 2 to 3 hours after they go to bed, you want to see in the rectal area, do you see any worms, okay? Number two, you can check for stool samples. So after the child has a bowel movement or an adult has a bowel movement, you want to kind of shift through and see if you can see a thread-like worm. You want to check the underwear. Sometimes it'll be stuck on the underwear. You can also use clear adhesive tape right around the rectum. So you take, let's say, a tape, you can cross it over the rectum like this, let's say overnight, or first thing in the morning before they go to the bathroom and do anything else, you take the clear tape and you dab it over the rectal area, and then maybe you can take that to the pediatrician and have them looked at. Sometimes the pediatrician will have this kit that you can utilize to capture the eggs and then send it out to the lab to have a evaluation to see if it's pinworms, okay? You want to do that actually multiple times just to make sure it's gone. So you want to do a microscopic exam of the clear tape. Okay, treatment, parental PAM08. This is a parasitic. It's over the counter, right? There's a brand called Reese's that makes one, but there are generic brands obviously available. It's very cheap. You can go ahead and do that. You can do albendazole or menbendazole. You want to do at least 2 doses. So what that means is that you do your first dose and then 2 weeks later do another dose. The medication tends to be ineffective to the eggs. It may kill off the adult worm, but the eggs are not going to be killed off. So what you want to do is 2 different doses, 2 weeks apart. Okay? That's why it's so important to do the hygiene portion of this while you're going through the treatment. Okay? You got to do the cleaning, you have to do the wash, you have to literally do all these things every single day in order to eradicate it. The other thing is you should treat the entire family. So let's say one child has it, the other child might have it, or they sleep in the same bed, etc. You want to treat the entire family to make sure that it's not being reinfected to individuals in the house. Now, it can be really devastating if you actually look at some of what can happen. Let's say a child goes to daycare, gets pinworms. They see visual pinworms, right? And then let's say you have an adult daughter who's 16, 17, or 18, and you tell them you got to have to take a medication because you might have pinworms, right? Or they might have to tell their boyfriend they have a pinworm. It becomes really traumatic for individuals too. But it's such a common infection. It's 40 million cases a year. You want to be able to go ahead and treat this appropriately to eradicate it from your household, okay? So the best route really is you need to do the medication. That's the fastest, most effective way to do it. But you can enhance it by eating more garlic, taking coconut oil in. You can use ginger, pumpkin seeds. You want to do high fiber foods like carrots, okay, to help bind some of the eggs and the worms out of our system. And you can do some anti-parasitic herbs that I've mentioned in other videos. I'll link the other video up in the corner over here. But you can use anti-parasitic herbs to just ensure that after you've done the medication that you've got the infection under control and it's taken care of. Again, this is the #1 parasitic worm infection here in the United States. My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.